All right, so we have a doctor writes an order for sodium bicarbonate infusion, 150 mEq per 1,000 ml D5W. The vials we have is 50 mEq per 50 ml. D5 1000 is the bag that we have. All right, take a look at this vial. 1 mEq per 1 ml is the concentration. The bag we have is 5% dextrose 1,000 ml. All right, so 1 mEq per 1 ml, very important. So you can just do it in your head, and you just see obviously 50 mEq times 3 is 150, and that's it. 3 vials is what you would use. Let's do the calculation. 1 mEq per 1 ml, it's on the vial. Take a look at the vial, 1 mEq per 1 ml. So we need 150 mEq. So X is equal to 150 times 1 divided by 1 is 150 ml. You need 150 milliliters. So we're going to, each vial in this example is 50 mLs. So we need 3 vials to give us 150 ml. And what we're going to do is we're going to withdraw. Don't forget to withdraw. Take out 150 ml from this bag of 5% dextrose. We're going to take out 150 and we're going to put in 150 of this 8.4% sodium bicarb. And that's it. That's, it's not hard to do. I know if you've never seen this before, then it's hard. So it's just all about practice and just experience. And that's it. There is something I want to tell you that's very important. So just stick around. Okay, so I just want to give you a warning. I want you to be careful. 1,000 ml of D5W dextrose, 5% is what we're using here. Do not use 0.9% NS, sodium chloride. Don't use NS because you're going to make it hypertonic. You're going to make the solution hypertonic if you put in 150 mEq of the sodium bicarb. So we don't do it. Do not do it. Don't make this error. We're using D5W. Again, be careful. I have seen orders of 100 mEq and 1,000 ml half NS, which is 0.45% sodium chloride. This I have seen in practice. So in the common infusions for people with acidosis is what I've seen is the 150 mEq in a 1,000 D5 or 100 mEq in half NS. Please put any questions you have in the comments. Thank you.